Healthcare Experience Matters listeners. We have a repeat guest joining us today. We loved the first episode so much, I had to have him back on. We're talking with Dr. Paul Glisson. He currently serves as Chief Medical Officer with Infirmary Health in Mobile, Alabama. And last time he joined us, we talked emotional intelligence as a healthcare provider. We love the conversation so much. We want to do a little tweak to that. And today we're going to be talking about social intelligence specific to healthcare leadership. But of course, so much is going to be applicable to anyone working in healthcare. So, Dr. Glisson, I'll let you take it from here. And just for listeners who might have missed our first conversation, do you just mind, refreshing us on who you are and what you do?
Sure. Thanks, Casey. Yep, I'm Paul Glisson. I'm currently serving as the Chief Medical Officer at Thomas Hospital, which is part of Infirmary Health System, based in Mobile, Alabama. It's the largest nonprofit healthcare system in our region here, and I'm excited to be here as part of Infirmary Health. Now, I've been here almost a year, and it's been exciting to see how different organizations place their leaders in their positions and the roles and responsibilities for them and how they set them up for success. So it's been good to get a different point of view on that. Before this, I was at Baptist Healthcare, was there about 11 years and served as their chief medical officer for a portion of that. And before that, I was a practicing emergency medicine physician full-time. And I still practice emergency medicine every chance that I get, several times a month here. And before that, I was in the U.S. Navy. So I spent some time as a leader in the United States Navy as a general medical officer and did quite a few exciting things there, too. So that's kind of my background, besides being an all-around, awesome guitar player. I don't know.
Nice. Awesome. Well, I didn't expect that last piece. Are you more of a Stratocaster man or Telecaster? What do you
Oh, I'm definitely a Stratocaster guy. I've got everything, but people say that they're a Gibson guy until they wear one for about 4 or 5 hours, and their back and their L4 vertebrae will remind them that there's a reason why people don't wear the Gibsons very long.
Wow.
I'm definitely a Stratocaster guy.
Okay, that's interesting. I didn't know that. Well, there you hear it from a doctor.
Yeah, your spine surgeon will actually encourage you to wear the Gibson.
All right, fair enough. That makes sense. Yeah. So before we talk social intelligence and leadership, just describe to us what some of the most vital attributes a leader in today's healthcare environment kind of must have, given what's going on out there.
Well, I think there's been lots of new challenges come up with the pandemic, the triple pandemic, the quadruple pandemic, our resources here, how we've seen the labor force shrink and then swell and then shrink again, and the whole new labor laws about how we or the unwritten laws about how employees expect to be treated, and the whole debate about remote work versus on-site care, which is interesting in healthcare because there are facets of both. So there's all these new rules that are going around, but I think it's still a focus on people and a focus on the big picture when it comes to leadership here. So that's one thing I've noticed that as it's just made it easier for healthcare leaders to focus on a bigger picture when you had these new challenges come up. Because otherwise, I think you would get used to the same old thing, just the routine grind. So this has given us new incentives here to focus on the big picture to see how all these new challenges affect us.
So I'm going to read the textbook definition here of social intelligence: the capacity to know oneself and to know others, and it develops from experience with people and learning from success and failures in social settings. So with that definition in mind for our listeners, do you think social intelligence is a prerequisite to being an effective leader in healthcare?
I wouldn't say it's a prerequisite. I would say if you have it, you're going to be much more successful, though. I know lots of leaders who are, probably on the spectrum quite a bit, and they are brilliant, especially in healthcare. When you look at physician leaders, there are a lot of brilliant physicians, and they do very well because people in healthcare kind of want to hear what they say. But I think you're going to be a lot more successful if you focus on your relationships with people And you talked there about failures in social settings. I think we all know people who are natural people person, a people person, and people who are not. And in fact, just a few minutes ago, I had a conversation with a patient about the patient just had a bad interaction with a provider, and I found myself saying, well, he's not a people person. And that was not good enough for her. That the patient wanted a better excuse than that, or wanted that addressed, because she did not think she'd be in that situation and not be a people person. So it did make me think about it quite a bit, because there are folks who struggle with it. And, it's not something that I think is probably you're born with. It's something you probably got to work on.
That's fascinating. I think there's kind of two elements in play here, and I'll have you react to this thought here. So there's, it's the social setting of interacting with a patient, and then social setting of interacting with colleagues. Is that what do you think? Is it both equally as important?
I think so. When you interact with a patient, it's important that you interact with them socially as if they were, a human being, and you have to take into account the fact that they may feel vulnerable in their situation. A lot of times when you're having that conversation, they don't have their clothes on; they're in a gown, or they've got paper shoes on, or whatever, and or they've got IVs and medications going in where they don't kill themselves there. So it's very important that you have social awareness and social intelligence at that time to examine that relationship as you discuss it with the patient. And then when you're coming in as in a leadership role, I think it's the other focus there should be that it's not about you. When you're at the car dealership and you're trying to get your car fixed and everything, and if you're still making that noise, you're having that discussion with them about it's about me, it's about my car. This makes this noise, and you're going to fix it. But when you come in as a physician leader, you really need to look at this as the big picture. It's not about me. It's not what Paul Glisson wants or what Paul Glisson needs. It's what your community needs. It's what your healthcare system needs, or it's what your medical staff needs. And you have to be able to put that aside and really look at it with a third eye to say, what does the situation require? So, it's that ability to look at that from a different point of view. I think it's going to make you successful.
How much impact do you think leadership has on creating an overall positive/healthy workplace in our cultures?
The workplace culture is your relationship. They're the same thing, and it doesn't really matter what industry you're in. If you're making widgets, if you're in a service industry, or if you're in healthcare, really your workplace culture is the relationship you have with the people you work with. So again, if you have social intelligence as part of that leadership style, it's going to make everything more healthy for everyone involved.
Yeah, and we kind of touched on this question earlier, but what advice do you have for people where social intelligence just doesn't come natural to them?
Yeah. So for those folks who struggle with it, I would say really focus on talking to people. And some of the best advice I ever got was I had a leader ask me to take people to lunch if I could not stand talking to them. He made me take a list of people that I really had a struggling to talk with them. He said, "Well, take them to lunch." And I remember thinking, "Oh my gosh, an hour with that person, I will not make it through the situation." But I didn't start off with lunch. It was kind of hard to do, but I did start reaching out to those people and making a habit to come by and talk to them more. And the more uncomfortable I was, the better I got at talking with people. So I think if you're having a hard time talking with people, a lot of people kind of struggle with an agenda, and they want to come in and hit these 5 points. And I've had people stop me and say, "But wait, I've not made all my points yet." And I've always thought that was odd. It's like, what points did you want to make besides just making a connection? And really, your point should be, let's make a connection. So if you're going in with an agenda to have discussions with people, my advice would be to put the agenda away. Maybe read it one time, put it away, and then think of a great one-liner. For instance, if I was going to come talk to you today, Casey, about social intelligence, I would say, okay, I want to hit these 5 points about social intelligence. Is it innate? Is it not? Do people learn it from their parents? Is it genetic? Those kind of things. I maybe make my list, okay, and I would put that away, and I would start this conversation with you, Casey, like this. "Hey, Casey, hey, good to see you today. Listen, I got a question for you. What do you think about tattoos?" I mean, I know there are some very good looking tattoos here, but my little sister wants one. And now I'm second guessing myself. What do you think, Casey?
I personally, I like tattoos. I think they're
Well, there you go. See, I think in done in the right spot, it'd be like a conversation starter. Like it could help you make conversation with people you don't really want to talk to sometimes there. So maybe I should think about getting a tattoo because I've got to talk to you today about some difficult things, and I'll roll into that conversation there. So it's just a way of being a human being and having a normal conversation with someone without the agenda. Because sometimes the agenda you trip on that quite a bit. So have a good opener, and then the closer will come naturally to you.
Oh, that's awesome. This is why we love having you on. Just really practical stuff here. I love it. All right. So, how important is self awareness when it comes to what we're talking about today, developing social intelligence and effective leadership?
Yeah. I think self-awareness has to do with your relationship with yourself. And if you look at the pyramid there of having a healthy mental attitude in life here, I think you start with your relationship with your body first, and making sure you're getting plenty of rest and eating. You have a great diet and at least some degree of exercise, which is the degree could be debatable. But once you have a great relationship with your body, then you have relationships with other people. And like we talked about already, just being able to have normal human conversations with people. But I think at the top of that pyramid is your relationship with yourself and self-awareness. So you really have to look at those relationships with the people first, and that gives you perspective of how aware you are of your own relationship with yourself.
Do you have any other thoughts on how effective leadership in healthcare organization impacts the overall patient experience?
Well, I think when you come to effective leadership, it's the foundation that kind of everything else is built on. If you don't have this foundation where you have effective leadership and the ability to communicate with the people you work with, then you get stuck in this maze on the side there where I can't really talk about safety numbers, or I can't talk about quality metrics. I can't talk about the number of falls we've had in the hospital here because I can't talk to you. So, if I have a great stream of communication back and forth with my leaders, then we really focus on the signal and not the noise around there. So that's what we want to focus on is increasing that signal to noise ratio. And the best way to do that is have a strong foundation of communication.
You've been listening to Dr. Paul Glisson joining us today. We're talking leadership, social intelligence. And so I'm going to give Dr. Glisson here the final word. Is there anything else you wanted to add to today's conversation before we wrap it up here?
Well, I'd say social intelligence it's an important aspect of any leader, and you can get practice on that by not only people you work with, but just people you meet in the mall. And if you have a hard time with that, just focus on having a good opener, and the closer will come to itself. And if you can't find a good opener, you can always start with gratefulness. It's always good to start off with, hey, thank you for so much that you've done for me, and really be genuine about that. And I think it comes through there. So if you open with gratefulness, it's easy to close with that as well. So thank you, Casey.
Thank you for your time today, Dr. Glisson. We look forward to hearing from you again.
Thank you.